Hi, everyone. It's lovely to virtually meet you. And I think that this webinar is actually quite timely right now, as we're all experiencing a moment of stress. And so hopefully this is actually a part of your day that you're able to just focus on you and give yourself some self-care. So thank you for the Center of Healthy Sex for inviting me to have this webinar and share with you guys a lot of my message and work around sex and cancer. And again, throughout, if there's anything that you want to say, hi, Henry. If anyone has any questions or any comments about what I'm saying, I have my chat open and I'm pretty interactive, so shoot away as I go. And if there's anything, if I go too fast, feel free to just slow me down. All right, so let's go ahead and get started. Okay, I'm gonna share my screen. Oh wait, actually I'm gonna open this and okay, I have to share screen first. Okay. This is the part you can edit. Okay. All right. And okay, sorry about that, guys. Okay. All right. So today, again, we're going to be talking about how your sexuality can change after cancer diagnosis and treatment. And a lot of my research really focuses on survivorship. And so in survivorship is this idea of this new normal. And I put quotes there because that's pretty much how most cancer survivors really see it. It's this idea that you're not really normal, but you don't feel normal. And that's one of these things that oftentimes amongst cancer survivors, they feel a little bit like they get the expectations out there are that, oh, well, you're done with treatment and you survived. And particularly with all of this branding out there on cancer survivorship, you're a survivor. The reality is that this idea this normal it's very new, and it can take years to adjust to life after cancer. And when it comes to sexual well-being, this is one of the most significant concerns that cancer survivors, both male and females, report to be one of their biggest quality of life concerns. So we're going to talk about some of these sexual changes, as well as how you or your partner can adapt. Okay? All right. Okay. So my goal today is that hopefully you leave here with an understanding of how cancer treatment impacts sexuality, how even just starting from diagnosis throughout your cancer treatment and into survivorship. I also want you to gain an appreciation of how prevalent sexual changes are after cancer treatment. Also, I'm going to teach you, and we're actually going to do some exercises with you to teach you how to enhance your sexual well-being, both in and outside of the bedroom. And I want to heighten awareness. There's, again, sexual concerns after cancer are a significant concern, and there's been lots of research in this area, and lots of nonprofits are doing more work in this area to really begin to start these conversations. And then the most important thing for me, for you guys, is to leave this webinar feeling empowered and not at all alone. That's the biggest thing. Again, sexual concerns are prevalent. And the number one thing, again, for patients, cancer survivors, and partners, sexual changes are significant. All right. So, sex. When you think of sexuality, what comes to mind? If you're in the chat, if you want to throw some chats up there, what comes to mind when you think of sexuality? And if you're shy, it's okay. I'll keep on asking. So when we think of sex, oftentimes people think of intercourse, but sexuality embodies so much more than that. It's how we walk into a room like Sandra Bullock there, the attitude that we possess, how we connect, how we use our eyes and our body, how we connect to our bodies as well as others. And when we think about sexuality, it is incredibly important to think that we are not just talking about sex. And when we think about sex, we think mostly intercourse, but that sexual well-being includes all of those things. And it's a dynamic, evolving process that is influenced by our personality, the personality we're just born with, but also the personality that we shape into, our sociocultural background, our gender norms, the way we take care of our bodies and the way we interact with our bodies, how we see our bodies, our self-image, and certainly how others have communicated to us about our bodies, as well as our values, all of these things. And you can all add, and if there's things that you guys think of when you think of sexuality, go ahead and pop those in right there, okay? There's so many dimensions to sexuality. And I really want to make sure that you appreciate that when we're talking, because oftentimes when we think about sex, we very much think about intercourse and how often or how little we're having it. But sexuality is our life force. Sex is where we came from. It is where our core is, those body parts in our body, but that our sexual energy very much is our life force. And so throughout my work in psycho-oncology, and I've also worked in AIDS, and throughout my career, the number one thing that has come across is that our connections and our relationships are central to our health. And so keeping that in mind throughout this, how sexuality is all encompassing and very much core to our health and well-being. All right. Amongst cancer survivors, unfortunately, estimates suggest that anywhere between 40 to 100% of cancer survivors can experience sexual dysfunctions. And unfortunately, particularly amongst those below the belt cancers, your gynecological cancers, so ovarian cancer, cervical cancer, uterine cancer, as well as for men, prostate cancer, testicular cancer. That's when you see sexual changes increasing even more being in the 90 to 100% range. And the reality, I mean, you know, sometimes we think, oh, sex is just natural. Oh, it's always fun. The reality is flat out, sex can sometimes suck. and sexual changes are complex. I mean, a good example of this is very much if you begin to look at how our physical, our psychological, our sociocultural, all of those factors interact and compound. So a good example is when oftentimes in cancer treatment, hormone levels of women will change and vaginal dryness will happen. And so there'll be vaginal dryness, shrinkage, and narrowing. Because of that, many women may experience pain when they are having any insertion or intercourse or engaging in those activities. Now, when we have pain, think about how our body reacts. Our body often reacts to pain by clenching up or, again, fight or flight. So when we are feeling anxious, when women are feeling anxious, and then on top of it, they're feeling pain during sexual activity and everything tightens up, unfortunately, that anxiety can exacerbate or make worse that pain, and then the tightening can increase. Next thing you know, avoidance. Anxiety feeds on avoidance. And so one of the biggest things that you'll see is that it only takes a few times for your body to experience that pain before it's like, you know what, screw this, I'm out. Okay. So this is really a pretty concrete example of and common of how you can see how these sexual changes evolve and over time generally worsen. So what you tend to see is that when individuals resume back to their pre-cancer sexual activity within that first 6 months, year, and they don't experience too many of these symptoms, then they're going to fare pretty well. Unfortunately, when these symptoms linger for more than a year, then that's where, again, everything about your sexual well-being, how you perceive someone coming towards you and touching your body, even just a touch, your body will react. Your body will react faster than your thought. Okay. And so again, these dynamics are complex and they're learned. Your body learns to protect itself. And that sexual changes can unfortunately linger long term. So again, one of those things that we do know is that there are lots of medical and behavioral and psychological strategies that can help up to 70%. And this continues to rise as we heighten our awareness and heighten what we understand of how we can address these sexual changes to improve sexual function. Now, keeping in mind, one of the things we know is that function does not equate to satisfaction. And that's really important to keep in mind because oftentimes this is where the question of how much sex is enough? Am I having enough sex? Am I normal when it comes to how I perform sexually? So again, one of the things to keep in mind is that adaptation of our sexual well-being after cancer, whether you're a patient or a cancer survivor or a partner, evolves, and we'll talk about ways to adapt that. Okay. So I hope that this reaches partners because unfortunately, when it comes to sex after cancer, partners typically get the shaft, and particularly our male partners. And think about it. One of the things, a lot of this research particularly has shown that, again, generally both men and women partners reported also changes in frequency, again, because sexual activity is something that they do together. And what you typically see is that as the patient or the cancer survivor, as they have more and more side effects, generally partners report lower frequency of sexual activity as well as decreased satisfaction. But they also experience lots of self-blame for even having those needs and even thinking, feeling guilty of course they're going through this, or if they're cancer survivors, then when does, I'm just being selfish of bringing this in, and very much sadness. And Henry brought in a question about how does aging fit in? And that's a great question. And again, one of the things to keep in mind, and that's where these changes that I'm talking about, cancer treatment often associated with chemotherapy or surgery, and we'll talk about some of those a bit later, most of these changes are going to happen to everyone as we age. If you think about your typical cancer survivor is diagnosed at 57. And so oftentimes what you're going to see is that these changes may become pretty abrupt. And when you think about partners, these partners have been probably with the cancer survivor for quite some time. And so, let's think about it. Sex can, like good and bad, can actually kind of get a little bit same. So when things dramatically change, a lot of people do not know how to deal with this, okay? Because you haven't really had to. So one of the things to keep in mind is that a lot of the changes that I'm talking about will happen. Most men will experience, men and women will absolutely experience a lot of these changes as they age, particularly once you get in your 50s, 60s, 70s, and 80s. And I am very much an advocate. I mean, certainly, there's lots of things now that this idea that as you age, you have less sex. Well, we're actually showing differently. We're showing that millennials are having less sex than older generations. So sex very much is a priority. And again, it does not just have to be intercourse. There are so many other things that you can do. And I'll show some pictures, but nothing super graphic. All right, so that's a great question. So another question in the chat was, my partner's sex drive has always been higher than mine. I already felt so guilty for not being in the mood, but when I got diagnosed with cancer, my libido was non-existent. I wish I didn't feel so guilty, but I also feel like I should be entitled to not care as much. Well, and that's actually a great question, and thanks for bringing that up. I think, definitely when I'm working with clients during treatment, and they'll find out, I specialize in sex. They'll be like, please, I'm completely tired all the time. I'm either in chemo or I'm home. Of course, that's the last thing on my mind. Whereas I certainly have had some clients who are like, it's actually the only thing that keeps me feeling normal. So some clients very much continue to have regular sex. It is a minority though, because again, cancer treatment can be harsh. We've done a lot of things to make it have not as many side effects, but certainly it's not by no means an easy ride, right? It's a huge stressor. So using the C card to actually have a hall pass and actually not feel bad. First off, if you do feel bad because you aren't able to, or not even wanting, because again, libido does go down, and we'll talk more about that. That is incredibly natural. The biggest thing is to actually talk about it, and we'll really go into that more. But that's natural. Again, these prevalence rates that I've been talking about, these sexual changes are common, okay? So going back to partners, one of the things that you see with partners are that their sexual satisfaction and frequency reported and their moods are very much associated with the patient or cancer survivor's physical impairments, as well as where they are in their treatment, how much they're experiencing those side effects, as well as keep in mind, generally our partners are generally working. I mean, a lot of cancer patients work during treatment, but generally they definitely are working. Also trying to go to as many treatments or doctor's appointments to stay informed and support their partner as they can. But then particularly if there are kids around or other family members, they're also trying to hold down the house. And again, I don't know if if you are a cancer survivor or a partner, cancer centers are these like fluffy clouds, and all the nurses and oncologists are actually generally quite nice. It's a very unique atmosphere, particularly the nurses in infusion and radiation. They're quite nice. And so every time a cancer patient comes to the cancer center, they're asked, how are you today? How you doing? They're having people to talk to. How often do you think partners are asked, how are you? Again, and then, so one of the things that you often see is that, again, partners rarely get the support that cancer patients do. But so what you often see is that partners experience as much, if not more, distress than cancer patients because of all those additional stressors. So on one hand, that question absolutely makes sense and is very common. And it's the tension that patients will feel guilty, but then the partners will feel guilty. And what you end up happening is silence. And one of the other changes that you see are that there'll be changes in perceptions of sex between both the patient and the partner. And so really, this is where I've heard many cancer patients say, gosh, I wish my partner could talk to me. You know, I wish they could talk to me because they appreciated how dramatically, again, the partner is the one who sees the patient the most generally. They're the ones who also see them every single day. And so, you know, it is different unless your caregiver, another caregiver, like a parent or a sibling or a friend is with them every single day. The partner sees it all and they see their body changing like that. And I've heard definitely some patients say, I wish I could have talked to my partner. I wish I could have supported him or her, but generally it's a him. In my experience, not generally, but in my experience of what I'm talking about with prior clients, they just were like, I wish he could have talked to me because I knew how my body changed and I got freaked out by it, you know? And again, partners can't do anything besides watch and offer some concrete support. And that's really, really hard to do. All right. So now let's talk more about what some of these physical changes are. Okay. So some physical changes that women may experience after treatment include vaginal dryness and tightness. Again, this is one of the most prevalent changes after cancer treatment associated with chemotherapy and putting women into early menopause. And what this is that when women will produce less lubrication in their vagina, and the vagina will become dry, it will shrink in length, and it will narrow. And so what that causes is extreme tightness. So much that oftentimes many women can't even insert a pinky into their vaginas. It's so tight. I've had some patients tell me that their vagina was so dry and tight that they couldn't even walk. And again, unfortunately, this is one of the most prevalent side effects to cancer treatment, but also one of the least talked about. Sandra, oh, okay. And I'll come to your question, Sandra. Thank you so much for that. So some of the other thing to keep in mind is that some sexual implications of this also, the surgical removal of a body part, certainly, again, and this not including just the breasts, you know, of course, breasts are very much how women see, it's very much of our femininity. And for men, any changes to their testicles or penis, all of those things, of course, are going to very much influence how you see yourself, how you see your identity and yourself as a sexual being. But it also can have other physical side effects that you can have tissue scarring, that area can lose sensation. And so there's other long-term side effects that aren't just body image. And both of them can be very hard to adapt to. So some of the sexual implications for women are decreases in desire or motivation, pain during penetration, and absent or muted orgasms. And as if it wasn't hard enough, ladies, to have an orgasm, so many women are like, yeah, I used to have powerful orgasms. Now they're like, whoop. So it can be very frustrating. Okay, I wanted to answer a couple questions. Sandra, you said, hold on, let me move this. Okay. Hi, I'm a couples therapist and have one couple where the man is a cancer survivor. He has rectal cancer. Yeah, you know, it's unfortunate. I've definitely seen a few rectal cancer patients and there's a lot of shame around that. And they often don't tell people that they have cancer and it's incredibly uncomfortable. You said some of what the partner feels is not being able to look at him the same way in terms of sexual attraction. And absolutely, again, that was a little bit what I was speaking to earlier. And it makes sense. You know, as an objective person, a person who hasn't had cancer, you're like, oh my gosh, that seems so shallow. But again, the reality is that when someone's body changes, part of our attraction is that physical attraction. But again, can be a lot of different things around it. around not just what it looks like, even though, again, many, particularly if the physical change is very dramatic. And I mean, I have had some, particularly when we're talking about rectal cancer, that already is such a sensitive cancer, and the idea of it already is going to shift someone's perceptions. And so the thing I want to speak to that, Sandra, is that it is pretty common, and I can't imagine. And one thing you could facilitate is actually like trying to facilitate an open conversation about what are the things that they are really scared or feel ashamed or guilty about. And one way is to actually just normalize it. Say what I just said of, okay, you know what, actually, because this is what I've done with a few of my rectal cancer patients, is that once you make a statement of, it's pretty common. This is, how many people have you guys told? And that probably has kind of come out already. But then what are some of the secrets you guys haven't shared? It's pretty common for both the patient and the partner to see themselves and see the other differently, because what often happens is that when the partner does have changes of attraction, and they are withdrawing, or if they're withdrawing or trying to be too fragile, the patient may feel insecure, and they're going to come up with all these hypotheses in their head, keeping in mind if the cancer patient was already distressed, their brain now is used to perseverating on worrying and worrying about how, perseverating on whatever those targets are, but particularly in something sensitive like rectal cancer, or if it is another cancer that can be seen externally, then body image very much plays a part. So they already have a heightened insecurity. And then if the partner is either overly fragilizing the patient or naturally isn't as attracted to them. Again, keeping in mind, when patients go through treatment, their bodies, even, because again, think about rectal cancer. It's not like they probably can see too much in that area. Maybe there's some scarring, but through chemo and radiation, bodies change like that. People can gain or lose weight dramatically. They will look differently, unfortunately. People will look sicker before they were diagnosed. Cancer treatment actually changes very quickly how somebody will appear and present. And that in and of itself can be very confronting for partners. It's hard to see, again, because cancer immediately alludes to death. And again, partners, so there's so many things in here that can come up that aren't necessarily, okay. And now you just added that she's been his caregiver and he had an ostomy bag, which she found disgusting. And you know what? We're actually running a study right now looking at sexual concerns, around ostomies. And that is absolutely natural. Now they have ostomy bags and actually, there's different ways you can place the ostomy bag. But again, this is something that perhaps, I'm not sure if it's going to be temporary or long-term for them, but immediately she had to adjust to. She didn't ask for this. There's no way to prepare. So first you can normalize that. And then again, maybe this is an opportunity where you meet with them separately, where you can actually process that with her and get her to really figure out what are some of the underlying things that make her find it disgusting, so that there's some concrete things you can do. Because like, for instance, odor, and they're pretty odorless, like as long as you're changing them constantly. But again, a lot of it is just that perception of it, because they're actually quite hygienic. There's also a concern that ostomy bags will leak during sexual intercourse. And again, there's lots of workarounds around that. There's lots of concrete strategies that you can do, but most of the time, patients will, and partners don't want to talk about it with them. So they're not even, it's not even broached. So if that's the case, Sandra, with your clients, that she hasn't even told them, then that's really where the conversation needs to start, is just by opening the space to say what she feels uncomfortable with, and ashamed, how she's carrying on any of that guilt. Because again, she still is caregiver. And that in and of itself, being a caregiver is not easy. Again, a lot of the caregiving literature started off with Alzheimer's, and gosh, caregivers are working so hard. And again, if the patient has a lot of physical limitations, they are burnt out. So this idea of caregiver burnout is high, and so again, normalizing a lot of those things, because that's unfortunately pretty common. All right. And Sandra, let me know if you have any more questions. So when it comes to men, physical changes that men may experience are, as you can imagine, difficulty achieving as well as maintaining an erection. So that's important to keep in mind, because some men will just get so frustrated that they can get an erection, but one, it may not be as strong as they're used to. And that's hard. So maybe they'll kind of like have a semi, but then they also just don't last as long. Okay. They have difficulty reaching climax, and that can be very frustrating, even if they are able to maintain an erection, but then not being able to climax. Something that most men don't hear about is dry ejaculate. And it's basically men they won't secrete any ejaculate when they have an orgasm. And think about this for men. If you're a woman, okay, if you're a woman and this seems like, oh, come on, at least it's not as messy, right? That ejaculate for both men and women is a form, it's a visual like indicator that, oh, I orgasm, because some women will absolutely be like, whoa, what? And they'll think, oh, they just stopped, but there's so much meaning in that. So it is actually quite scary for men, just almost like as scary as it was when they first had an orgasm and ejaculated. It's as scary when the first time they have an orgasm and they don't. And then lastly, also, and again, there's many more, but incontinence during sex is incredibly prevalent. Again, going back to Enrique's question about how this affects with aging. Again, incontinence is a reality for all of us. This is why, and I'll talk about Kegels later, but as we age, this is all going to happen. Oftentimes what you see is that incontinence occurs because as a reaction to surgery, or if the muscles around where whatever was removed become weaker. So some of the sexual implications to this are that they may avoid sexual activity. That's, again, the first thing we're going to do oftentimes is avoid. If there's a problem, hands are off. And certainly decrease libido, because oftentimes what you see is worsened mood, which then also leads to decreased libido and just feeling like, well, if I can't even do this, why even bother? And one of the things, particularly when you're thinking long-term, keep in mind that our sexual function very much it's a muscle. We have a sex muscle, and so it's important to actually keep that in mind. All right. Okay. And certainly there are many emotional changes to sexual well-being, changes that impact our sexual well-being. Certainly stress. I mean, cancer and its treatment. And then again, returning to this new normal, all overwhelm. The cancer itself is attacking the body, so the body is going to have to fight that. But then on top of it, treatment, again, thinking about chemotherapy and how it works. Chemotherapy is breaking every growing cell in your body. And so all of that is physically and taxing, and then emotionally taxing, and then maintaining life around it, making sense of all of these things. it is very common that people are going to feel stressed. But it's really important to keep in mind that actually when we're talking about clinical depression or anxiety, you actually see rates being around 25, 30%, because most individuals are actually quite resilient. But yes, stress is going to be there. Whether or not they actually become depressed or anxious is a different story. All right, certainly changes to body image. Again, whether it's an internal organ or something that you physically can see that change, certainly cancer affects how we see our body. And one of the most prominent and significant issues in cancer survivorship is fear of recurrence. So fear of cancer recurrence continues to be one of the biggest concerns amongst cancer survivors, and that uncertainty of waiting for the other shoe to drop. You know, in most cancers, a cure for cancer is 5 years after the end of treatment. And so really keeping in mind, like how many times cancer survivors will really worry about, okay, things seem okay now, but things seemed okay before I got diagnosed. And recurrence means that the cancer came back, and now generally first time individuals will have cancer. It's more, they're really shooting at it. So again, fear of cancer recurrence and the uncertainty of life for both the patient and the partner is one of the most significant concerns in survivorship. And certainly if individuals or their partners are experiencing anxiety and depression, all of those can go into this. And this question about incontinence from one of the attendees, I'll go back to that. I already had incontinence as I've aged. I'm now 63 and had 3 children. After my gynecological cancer, my incontinence got even worse, and I wear pads to bed. I actually want to be intimate, but feel so unsexy, and I'm worried I may be incontinent during intercourse. What can I do? Again, that's such a common concern. And again, particularly if you are experiencing this younger, I have had some gynae cancer patients who were younger, incredibly fit, and experiencing incontinence. And so we're not at all thinking that they were ready to use diapers. But in this case, again, it sounds like you already had some, so you'd kind of gotten used to it, but now it's gotten to the place where you actually have to wear pads. You've lost even more of your pelvic strength and your pelvic control. And so that worry is absolutely legitimate and common. And again, here's where some workarounds are. And but particularly for around incontinence, some of the things that you can do are to, 1, empty your bladder, stop drinking. If you just need to plan a little bit more about when you're going to be having intercourse or sexual activity. So empty your bladder fully and try not to drink water for at least an hour and a half before. And then a little bit of this is actually becoming comfortable, because oftentimes if you are going to be incontinent and your bladder is empty, you actually probably are only going to urinate a little bit. And so one of the ways you can begin to get used to that is a little bit of just trying on your own, being on yourself, self-pleasuring, and figuring out, okay, how much is this? And actually becoming accustomed to that. Depending on the severity of your pelvic control or pelvic damage to those areas, certainly I'll talk more about pelvic floor exercises, but I very much recommend that you see a physical therapist who specializes in pelvic health. I think that that's very, very important. So those are 3 tips that I very much recommend. Okay, and I'll talk about them more. So some of the emotional changes to sexual well-being are the implications of this are that hormonal changes, certainly, again, when we experience stress or are a lot of our hormones and our neurotransmitters are changing, and that can affect our sexual responses. So cortisol, certainly with stress, as that increases, certainly that our estrogen and testosterone levels decrease. Okay. We are going to, women and men are also going to experience decreased libido. They're just not going to be in the mood. They may be distracted during sex. Many people just say, I can't keep my head in the game. And again, avoidance. Avoidance of not just sexual activity, but of even cuddling or holding hands, even those signs of affection. Okay. So what you see is that oftentimes, unfortunately, so much of the reason, cancer patients go through treatment is to live, but then they come on the other side of it. And the most important, their partners and their relationship with their partner, one of the most important things for living becomes, deteriorates. And so one of the things that's really a lot of why I started doing this work, was because it kept coming up, and it seems like, gosh, you did all of this to live. Yet all of these factors that we just talked about impact what that life actually is. And what the experience of that life is. And so feeling very disconnected, not only to your own body, but to your partners. So keeping in mind that a lot of these side effects that we talked about can affect throughout the sex cycle. So affecting desire, thinking, and particularly again with nausea, mucositis, hair loss, affecting arousal. Again, this is where we see problems with anxiety, hormonal imbalance, vaginal changes. And then during orgasm, again, being distracted, during sex, and having problems there during the plateau, certainly problems with orgasm. And then this is definitely the worst, certainly bleeding. Oh, wow. Oh, gosh, sorry. Okay, I'm going to keep going fast. Sorry, I thought that I had an hour and a half. Okay, whoops. Okay. All right. So the most important thing that we do know is that with help, with interventions, we actually can improve sexual well-being. Sorry that took so long. Okay, so one of the big things that is in a lot of sex therapies really is a big focus on communication. This is the one thing that is really important to keep in mind, though, is that oftentimes individuals experience cancer. For many individuals, the experience of cancer and its treatment can be pretty traumatic. Again, the changes in their bodies, a lot of those things, particularly when it is not when there's a lot of physical difficulties or side effects during treatment. So again, it is common to shut down. Our brain actually shuts down and actually can make it hard to communicate. Our Broca's area in our brain can actually make it shut down to protect ourselves when we have, complex trauma and long-term trauma. So keeping that in mind, but at the heart and soul of many of the treatments are communication. Certainly treating the underlying causes, and when possible, minimizing any of those physical changes that you can, and I'll talk about how. And again, providing alternatives to intimacy, and giving information and looking at other ways. And then again, very few people will actually need to refer to a specialist. And this is the thing, that specialist is often not going to be a gynecologist and urologist unless it's a specialty health clinic, okay? So the first thing I recommend is, one, start talking to some sex therapists. If you, just to even find out if there are any physicians that specialize particularly in sexual changes, particularly after cancer, but that actually can help. All right, so now let's actually just go through some of the treatment options. The first option is vaginal moisturizers. So vaginal moisturizers generally can be bought over the counter. And what these are creams that you put in the vaginal area, and you should put them on daily, women. And so what this is trying to do is actually improve the overall vaginal health by restoring the natural pH levels and lubrication in the vagina and the vulva. So one that I often recommend is Replens, keeping in mind that this has to be done regularly, okay? And as it's being done, then I actually recommend using dilators, which I'll get to next or shortly. Another treatment option, more on the spot, are lubricants. And I absolutely do not recommend KY or Aquifer. So lubricants are being used more right at the moment of sexual activity. And KY you can get at any drugstore, but I don't recommend it. It gets really sticky. And Aquifer, the number of cancer patients I have been told that have told me their doctor told them to use Aquifer. I do not recommend that. It's petroleum jelly. There's so many lubricants. One of my favorites is Pseudo. You can order it online or at the Pleasure Chest. Go to a sex store, have fun. And try some out. They're made from, either water-based or silicone-based. And there's some that have flavors, but try it out, because one of the things is lots and lots of lube. And again, this goes across the age span, okay? Everyone should have a bottle of lube in, in their bedroom or in multiple places in the house and even in the car. All right, so once you are using vaginal lubricants or lube, definitely when you use vaginal dilators, you have to have lube on. But what a vaginal dilator is basically, it's like those little Russian dolls where one's built in the other. But you're gonna start with the smallest one, and you basically insert it into your vagina. And actually what I tell patients is actually to just put a bunch of lube on it. And I have a video for this in my interventions, but is actually to just kind of knock on the door and start there, to actually, because again, your body's already going to clench up. So keeping that in mind, and then slowly putting it in, and bit by bit going at your pace, and then bit by bit doing circles. Again, this does not all have to be in one shot. I recommend that you do this when you are alone, where it's private and you can just be relaxed, okay? And this generally has to happen at least 4 weeks post-radiation or surgery. So another treatment exercise, particularly for incontinence, is pelvic floor exercises. Again, and these are basically when you're clenching your pelvic floor. You first will learn how to do it. Again, the one thing I recommend is there's lots of great YouTube videos, but also working with a physical therapist who specializes in this. So right now I'm doing Kegels. And what these are really trying to do are increase your pelvic floor strength. They can also heighten your arousal because you'll be more sensitive there. And when you don't have to worry about pain or incontinence, you're able to focus on the pleasure of sex more. And that's where the experience expands. And it's a little bonus for your partner because they can actually feel your vaginal movements when either their hands or penis are inside you. All right. Now, with these treatment options for non-genital pain, again, one of the things to do is to plan to take any medications ahead of time. Focus on the physical sensation and connection with yourself and your partner. So a lot of my intervention, Lori Brotto at University of British Columbia, she actually just released a book last year on mindful sex. And we incorporated mindfulness into our interventions. And really the focus is on really heightening your sensations in your body, which really keeps you present, connected to yourself, and then connected to your partner. Again, keeping in mind, we know satisfaction does not only depend on, does not equate with sexual frequency or activity. So mindfulness, playful touch, again, Not always just going for the gusto and going straight to intercourse. Having fun. Sex is meant to be fun. And when your body and both of your bodies have been so scared of it, starting off just by playfully, tickling each other. Non-coital sexual activities. Again, I recommend that if it has been epic fails for a long time when it comes to intercourse, hands off that area. You got to build back up with your body. And actually, I say, don't worry about that right now. Okay. There's too much pressure on that. So focus on other things. Focus on body massages. Find out, again, your body has changed after cancer, and our bodies change as we grow and as we age anyways. So focusing on those non-coital sexual activities. And sensate focus is one of the most effective behavioral strategies in sex therapy. And again, really what this is working on heightening your focus of the sensations and taking turns initially between who's receiving and who's guiding versus who's actually giving and touching the recipient. And then certainly trying different positions, particularly if there is any pain or if there is any insecurities, around what body part has actually changed. Many of my breast cancer survivors still wear their bras. But then I'll also tell them, I'm like, okay, take it from behind or have them, figure out different positions where you feel less conscious. Those are really, really important. So this is a graphic from our study that we actually included. For men, certainly, the first options that most men are going to receive are pills. Okay, they're going to get Viagra or Cialis generally. And the thing is that unfortunately, after cancer treatment, it's pretty rare that men are not going to have some kind of connection between their physical dysfunction and distress, okay? So unfortunately, what we see is that oftentimes in the context of cancer treatment or any chronic problem, chronic health issues, meaning that they've had stress associated with that, these pills don't often work, but certainly that's generally where most men start. Also, there are penile pumps. And again, one of the things with penile pumps is that it's really used for rehabilitation. So the idea is to get the penis, strengthening the penile muscles so that then it can actually begin to actually get more custom. Again, we're building back up the practice of actually bringing the blood flow into the penis, okay? So oftentimes people think, oh, I can just use the penile pump once and then I'm going to be erect. That's actually generally not how it works. You generally have to use it over and over. And then it comes with some rings, cock rings, that you slide off of the pump and then put on to try to maintain that erection. One of the most effective, but also scary, is penile injections. And this is where men will actually take an injection, put it right in their penis, not on a vein. And this is where patients can experience multiple orgasms, and they're going to sustain a erection for anywhere from 30 to 45 minutes. It's actually pretty amazing as long as you get over that first very natural, but surprisingly, once you start doing it and you actually see the benefits, men overcome that initial fear of, I'm literally sticking my penis with a needle. Okay. All right. And again, oftentimes you hear of Kegel exercises just for women. Absolutely not. It can absolutely help men too. And again, they just may need a little bit. I very much recommend men going to a physical therapist who specializes in this. All right. So those are a lot of the interventions. I'm going to talk a little bit more about what we've done and what research has been done in this area and where you can find some support. But unfortunately, there's a big gap between who needs the support and who actually gets it. And often this is because clinicians don't know who to refer to, as well as they don't want to deal with it. They may feel uncomfortable or embarrassed just as much as the patient. So neither one of them brings it up. And oftentimes the focus is just too much on the patient and doesn't actually engage. So again, Sandra, that was a great question about the partner and her concerns, making sure that she is part of those conversations so that they can both deal with them, you know? And then again, so lack of attention to partners. So a lot of my initial work really started off by exploring where people got sexual concerns. So we actually, information around it. So we interviewed several cancer survivors, I think it was 352 or 350, and where they got it. And most really were, 323, getting it from a book or the internet. Very few actually go to their oncologist. And that's really important to know, because again, there's a lot more information out there now, but it's still really not talked about. As far as what most women are doing is that they're using lubricants, vibrators, some creams. Again, most of the things are at the moment on the spot. And one of the things that a lot of my studies do is actually integrate a lot of qualitative interviews. And so this really speaks to the sentiments around sexual health or sexual well-being after cancer. Is this person said, their oncologist said, well, is your sex life okay? Do you have sexual function? I don't even know what that means. Do you have sexual function? Because like, that's just an inappropriate way to ask that. And she said yes, and then was on to the other thing. So again, there's unfortunately a lot of my other work that I'm not talking about today has been in really improving communication amongst clinicians, gynecologists, primary care physicians, to really actually use assessment of sexual well-being as a holistic approach to assessing a patient if it's a first consult, but also to really address quality of life. Okay, so I used to be a professor at University of Sydney, and I worked with colleagues there and as well as other universities throughout in Canada and here in the States. And we developed Rekindle, and it was the first e-health intervention, web-based intervention that really actually was made for both cancer survivors and their partners. And this time what we did was we didn't make it cancer specific. We made it need specific, or what their unmet needs were. And so basically what we did was everything was tailored but for patients or partners, for men and women. And this was the first intervention ever developed for same-sex attracted as well as heterosexual individuals. So there were 12 versions in general. And really at the heart and soul of Rekindle, we made about 250 videos of different cancer survivors sharing their stories. And I actually wanted to share one, mostly because if there's anything you leave with here, it's that you're not alone. So turn up your speakers so that you can hear this and get ready for a chuckle too.
See, I'm more particular about incontinence than the sexual activity. Yeah, so the incontinence is a big thing. Yeah.
But that's improved too.
It has, but it's an ongoing thing in terms of going to the toilet a lot. That's a big thing because my bladder shrunk down. So I might go to the toilet where I used to go maybe twice a day. I might go 6 times a day. So it's not that I'm going into the men's toilet for, hey, let's have a look. It's actually because I've got to empty my bladder. And that's for the audience, that one, all right?
Good he point. Weed on me once.
Once.
Because when he ejaculates, nothing comes out. But this one time, he urinated on me, which I really didn't like. But, you know,
well, what happened was the bladder. There must have been some urine in the bladder. So through the point of ejaculation, which there's no semi-fluid, but the feeling is exactly the same, some urine came out.
Some, a lot.
Which I thought at that particular moment, oh my gosh, the semen's back. This is fantastic. But no, it's a bit of urine. But the sensation was more fulfilling for sure.
So those guys were hilarious. And we filmed actually, we filmed Rekindle in my apartment when I lived in Sydney, and we turned it into a whole set. Anyways, and when I welcomed them at the door, they said, hey, just as a heads up, they were friends of a friend of mine. And they said, hey, as a heads up, we've never talked about any of this. And they've been together for like over a decade. And they like, we've never talked about this, but so-and-so said that we're in good hands. So for them to be so frank and so open about their experiences and just freaking hilarious. I felt so honored, and we were so lucky to have them on board. We also had some of the best oncologists and social workers and doctors who really focused on quality of life amongst cancer patients and survivors. And they really were part of our research team, and also gave a lot of their insights from the physician's perspective to Rekindle. And then we hired some actors to teach a lot of the skills that we had. We made this was a burst your bubble, and all the bubbles come up to dispel some myths to make it really interactive. And then we taught about how to read. Again, one of the things to keep in mind is that your body is going to change first, and your facial expressions are really where you actually are going to first emote. Your body first is going to express your emotions. And again, your body after cancer may experience new emotions. So with it are also going to be some new changes. Facial expressions. So we came up with a quiz for that. All right. And then we also made a decision-making tool about, what tool would be right for them based on their priorities. All right, and Rekindle definitely improves sexual satisfaction, sexual self-disclosure and efficacy, and their reported unmet needs around sexual well-being decreased. We got a lot of positive feedback. It said, I think this sort of start could help a lot of people who are not otherwise a bit short of resources. Again, there's a lot of shame and embarrassment around sexual well-being, and so it's really important to get this support out. One thing to keep in mind is that, one thing we did find is that amongst the individuals who were clinically significantly distressed, they would sometimes get actually more distressed. And this is a problem with a lot of e-health interventions that don't triage individuals. Because the thing is that now we're actually asking them to face one of their biggest concerns, but they haven't yet figured out how to manage that anxiety. So even though a lot of these things I'm saying, their readiness for implementation or alongside that anxiety needs to be managed. And I think that that's really important for clinicians to keep in mind. So in its attention to this work, I'm also received funding, and we actually are having a pilot now to develop the first sex therapy for Latinas. And so this is specifically Aviva, and it's an app that is for Latina breast and gynecological cancer survivors. And so I'm partnering with cancer support nonprofit organizations throughout the country. And we are actually recruiting for this now. So if you have recently been at least 6 months post-treatment and you're Latina from breast or gynae cancer, please reach out to me. I'd love for you to be in the study and try Aviva out. So as we are wrapping up, what are the next steps? Again, what can you take from this? First and foremost, start the conversation. Just start talking about it. Talk about it with your friends. And even before you do that, you can talk about it with yourself. You can look in your mirror just like this and just start actually acknowledging how much has been taken away from cancer, and grieving that, because these changes you weren't expecting, your partner wasn't expecting. These changes happen abruptly, unexpectedly, and cancer affects everyone. Okay. It's some way or another. We are all impacted by cancer. Everyone who's listening, and everyone, I've never met anyone who actually doesn't know someone else who has cancer. So the first thing is to start the conversation. Whether you're a health provider, Particularly, it's a great way to actually begin to get to know your patients and actually holistically assess them. So start the conversation about where you are at in your sexual well-being after cancer, both for cancer survivors and partners. Keep in mind, you are not alone. All of the concerns I talked about today are so prevalent. And again, they're not just prevalent for cancer patients, but they are going to happen as we age. Again, Enrique's question was great. Describe your sexual concerns to a doctor, okay? At least try to, and if that doctor doesn't know, don't sweat it. Start looking online, okay? And you can reach out to me, you can reach out to a sex therapist in your area, and they can help you actually look online of who might be able to help. And when you're ready, talk with your partner. Whether you're the partner of the cancer survivor or the cancer survivor, you gotta have the conversation. It at least needs to be acknowledged before it can ever get fixed. Again, it does not take your body long to get used to a lot of these sexual changes. And the longer they linger, the longer they stay. And be patient. Sex does not have to be rushed. Your process and your relationship with your body and your partners, there is no rush now, okay? So be patient and be kind and compassionate to yourself and just try different things. It's very common to try something and get frustrated and give up. And then prioritize your health inside and out of the bedroom. Again, sexual well-being is core to our health. I think it's a very efficient target to actually optimize our health. When you think about your relationship with your body, how sexy you feel, how empowered you feel sexually, that generally is coordinated across almost every health behavior with your sexual well-being. So I hope, before I sign off, again, are there any questions that anybody has? Thank you, the Center for Healthy Sex, for having me. Again, my name is Dr. Catalina Lawson. I'm a clinical psychologist, and if you have any questions, feel free to check out my website at www.drcatalinalawson.com. Or you can email me at contact@drcatalinalawson.com. And feel free, I make a lot of videos, and you can find me on Instagram, YouTube, or my Facebook group. All right, guys, thank you so much for having me, and I hope you all take care and have a super sexy day. Take care. Bye-bye.